Okay, good morning, good afternoon. Welcome. I am truly delighted to be here today to introduce Dr. Amelia Latu Afuhaamango Tuipulotu, Chief Nursing Officer for the World Health Organization. Amelia is a visionary global nursing leader dedicated to advancing the nursing profession, strengthening health systems, and advocating for equitable healthcare worldwide. She has held pivotal nursing leadership roles, including serving as Tonga's chief nursing officer before becoming the country's first female minister of health. Her work has been instrumental in shaping nursing policy, strengthening workforce development, and driving global health initiatives that elevate the role of nurses and midwives in achieving universal health coverage. It is a great privilege of mine to have Amelia here with us today. Let's dive into this great discussion. Welcome, warmest welcome, Amelia. Thank you so much for making the time.
Thank you. Thank you for having me.
Yes, to begin, could you share a bit about your background in nursing and your journey becoming the chief nursing officer at WHO?
Thank you very much, Dr. Rebecca, for the opportunity to have a conversation with you. My nursing background, I did my bachelor, master's, and PhD in Australia. My first post in Tonga was to be in charge of a surgical ward, the busiest ward of our main referral hospital. And then after 1 year, move on to the psychiatric ward, where I really loved this ward and the work there and the patients. But then being asked to uh, join the faculty of nursing and midwifery, so went there and became later the director of nursing, government chief nurse, as you have shared, chaired the South Pacific Chief Nursing Midwifery Officers Alliance for many years, and was just about to leave Tonga. And then the Prime Minister at the time asked me to stay back and was a member of the WHO Executive Board and Executive Board Rapporteur, and was a consultant in Manila in 2022 when I left, after I left Tonga, and then have the privilege of working now at headquarter, WHO headquarter, to support all the 30 plus million nurses and midwives around the world.
We are so grateful for you. You are the second chief nursing officer, is that correct? For WHO, after Elizabeth, I believe.
In during this time of the current DG.
Yes. Okay. And what does the role function of the office of the chief nurse of WHO like? What is the role of your office?
My office mission is to strengthen future health systems and advance universal health coverage in relation to access and safe and quality care, and of course, to advance also the sustainable development goals. But in doing so, raising the profile of nursing and midwifery, advocating for investments, and ensuring that their competencies are well utilized and that they are protected, supported, and valued and respected within the health systems. And some of the key activities of the office includes global leadership, global advocacy, global visibility, policy implementation. You know very well our global strategic directions for nursing and midwifery, advocating at the global level for implementation of those policy priorities, and advocating for partnerships at the global level to strengthen and support nursing and midwifery. Also, at the same time, working within the WHO three levels
Mm.
to coordinate nursing and midwifery work and support both regional and country office work, but also working robustly within all programs within WHO to support and give nursing and midwifery perspectives into those programs like primary health care, NCDs, IPC, universal health coverage, and so many of the programs. At the same time, we're doing our 25 by 25 basic emergency care campaign that aims to promote and support nurses and midwives' participation in basic emergency care courses to save lives. In the past, WHO have been implementing in more than 60 countries and have trained more than 50,000 healthcare providers on BEC, but only about 25% had been nurses and midwives. So we are trying to boost nurses and midwives' participation in BEC training. And of course, we have the Nursing and Midwifery Global Community of Practice, and we are looking into the future to build regional hubs whereby government chief nurses and nursing leaders and midwifery leaders come together and have a conversation and policy dialogue and see ways they can support the implementation of policy priorities at the country level for impact. I think that's
You have your work cut out for you, Amelia. You're incredible. Your office has such a large role, and I think for nurses working on the ground or working in different areas, they might not know how much is being happening at this higher level. So thank you for sharing. And then you mentioned you're at the headquarters in Geneva. How do you engage with countries or regions, or how does that kind of dissemination occur? You mentioned maybe there's regional leaders in nursing that you work with.
Mhm. WHO has 3 levels. So headquarter where I am, and at the regional level, there are regional nursing and midwifery advisors at the
Mm.
region who are supporting the country levels. So we work in alignment and seamless to support country work and implementation of policies for impact at the country level. So we have monthly meetings with our regional advisors and all the nurses and midwives within WHO 3 levels to discuss work on the ground at the regional, but also country context and implementations on the ground. So that is very important work for us to ensure that there is implementation and impact at the country level. Of course, guided by the policies within the global strategic directions for nursing and midwifery.
Wow, amazing. It's so exciting to hear how everybody's working together, even if we might not know it, as nurses, we're working across the globe, but yet it's happening. And through your leadership, thank you so much. When I think about the vision for nursing future, we know that WHO plays a crucial role in shaping the future of nursing. So, what is your overarching vision for nursing in achieving WHO's global health goals?
Right. For my office, my vision is to be that trusted global leader and trusted global champion to strengthen nursing and midwifery, to maximally transform health systems. In doing so, to advance health equity, gender equality, and universal health coverage for all people. Last year, the General Program of Work 2025-2028 was approved at the World Health Assembly, and its impact is more people everywhere attain the highest possible standard of health and well-being. And nurses, of course, play a crucial role in supporting that impact. And its goal is to promote, provide, and protect health and well-being for all people everywhere. And of course, we know very well that nurses and midwives play a critical role in promotion, providing, and protecting health and well-being for all people from national, subnational, rural, remote, and outer island contexts. For me, looking into the future, and this is partly a personal thinking, I have been thinking about a reset and thinking about nursing and midwifery in 2050.
Mm.
And that is something, very important for me. And some of the key thematic areas within that is one is better and fair salary and better working conditions in order for us to recruit and maintain talents for the long term. So I will not go into details as we may speak about it later, but another one is the importance of maximizing and optimizing nurses and midwives and advanced practice nurses' roles. And one of the key things is also with regards to leadership. And two of the key things that I think are very important for leadership is diplomacy and also inclusiveness, that the leader is not on her own, that she is engaging with key partners on the ground in the member states, with finance, with politicians, with development partners, and all relevant stakeholders to advance and strengthen and to ensure a sustainable investment in nursing and midwifery.
Wow. Yeah. I love hearing your thoughts on this. And I think that since the State of the World's Nursing came out in 2020, that was in the height of the COVID pandemic. And um, it's an event that significantly impacted the nursing profession so much. And I reference the State of the World Nursing Report all the time because it's such a pivotal piece speaking about some of these things. But from your perspective, after COVID, what maybe changed in global nursing, or what do you see most pressing challenges for global nursing workforce today?
Of course, we know with regards to the high international mobility and recruitment of nurses around the globe, especially from low middle income countries and least developed countries to high income countries.
Yeah.
However, some of the advancements that I am seeing, and I hope that we can go to global scale, is with regards to leadership training. And I mean leadership training at all levels, at frontline, which is for me very important, so we can continually improve and for continuous development of care at frontline. And I often wonder how we can use AI and latest technology so that we can get real basic data at the fingertips in real time to improve care at the front line. The other one is maximization and optimizing of nurses, advanced practice nurse and nurse practitioners role. I think this is very important. And this also includes the basic emergency care that is accessible to nurses and midwives and can enhance the competencies and the skills of nurses and midwives around the world. I think the other thing is I have been seeing some rethinking around education for the future, given AI, aging population, and the need to advance primary health care. So I think that there are some advancements in global nursing in many areas, of course, in research also and regulation. but things need to go on scale and what is most relevant in the country level for greater impact moving forward. Thank you.
Wow, thank you. Yeah, I feel like some of the issues at the high level we even see on the systems level down in our hospital systems. How do we, make the work meaningful for nurses so that they want to stay? How do we help them make their job a little bit easier? How do we give them the wages that they need in order to live and to treat this as their career and to really invest? Because as we invest in them, we know that that invests in healthcare for our regions, our countries, our hospitals. And thank you for your leadership and vision on that. When I think about, I've been a nurse for more than 20 years, and it's taken me I wouldn't say a long time, but I would say a long time to really get into the policy advocacy place. And we know that nurses are so central to healthcare delivery, system strengthening, and yet they remain underrepresented in policymaking and decision-making roles. In your view, what role should nurses play in shaping health policy at the local, national, and global levels?
I think it is very important for nurses to be at the policy table at local, national, regional, and global levels. We know that women comprise about 60% of the health workforce, but only about 25% at the leadership level. This should not be the future, and we must do our very best at all levels to advance women, including nurses and midwives, participation at the policy table, and of course be able to contribute and shape policies and change policies to enhance health outcomes for families and society. At the local level, it is very important that nurses are represented at the policy table because I think that's where things will have to start and escalate from there. From my own experience, that was one of the best preparation to work at regional and global contexts was to be able to have the wealth of experience of sitting around the policy table where it is male dominated and medical dominated, and where I was often the only female and younger than the rest of the team. But that wealth of experience have taught me a lot that we couldn't learn from books and from leadership courses, and have helped you navigate tough challenges and debates that has to happen at the policy table. And you're happy at the end that you have contributed to policies that support better health outcomes for the communities. So I think very important that nurses and midwives are at the policy tables, right from the national, regional, and global context. Because without that local experience, I don't think I will be able to successfully navigate regional and global policy levels.
Yeah, I find that.
And also we need to be courageous as women, as nurses and midwives, because we need to role model to the largest healthcare professionals and women and girls that they can aspire and be inspired to take on nursing and midwifery, and that they can, if they would like to, be at the policy table into the future and be able to shape policy for better society and better health outcomes for the population.
You so much. I think that's so inspiring. I think sometimes nurses feel, or I grew up feeling maybe that my voice wasn't as important as the physician voice, or the other people had so much more experience than I had to offer. And I've come to realize how important it is to be at the table and to be a part of shaping the future because we've touched patients, we've done that work, and your message is really helpful to kind of promoting nurses really getting involved. And if this is an area of your passion, you can make change and getting to the table. We want to support that. And we really think that their voices are very important. And I thank you for your leadership in that. And as we look ahead, what opportunities do you see emerging for global nursing leadership and practice in the next 5 or 10 years? And how can nurses best prepare to meet the advancing demands of healthcare and the needs of our populations?
Before we go on to that question, I just want to emphasize that nurses and midwives have wealth of experience on the ground at the realities of point of care in hospitals and in communities and various settings. So those wealth of experience, nurses and midwives can better contribute to policy dialogue. They understand the challenges that families, women, when they come for care at hospitals and community centers, they understand the needs of disability, aging population, vulnerable groups. And those wealth of experience at realities are very, very important to driving policies that are relevant to enhancing care and improving health outcomes for the population. So looking ahead, for me, it's very important at the point of care level that nurses and midwives must speak up and transform practice every day. I think as I have shared, with simple, real data and information, we can have a deeper understanding of key issues and challenges at the frontline point of care and the challenges patients and families and individuals face so that we can better support and see ways that frontline care can continuously transform to improve care for the population. And I think with a strong engagement of the population, it will build not only better health outcomes, but also building trust within the population. I think also it's very important at the national level that nursing leadership, champion and be visible in driving key priorities for development of nursing and midwifery at the local level and be seen to be actively delivering at the country level with strong partnerships, of course, with nurses and midwives, but also within the health system and with finance, politicians and development partners, regulation and education. It's also very important to build regional solidarity and be visible and champion some of the regional work that are planned and done to enhance the region as a whole. I spoke about the South Pacific Chief Nursing and Midwifery Officers Alliance. We came together to deliver on key projects, one of which was leadership capacity building for nurses and midwives, but so important that building that regional solidarity. And of course, very important to be visible at the global stage uh, and be able to drive and advocate at the global level to support nursing and midwifery, but always with the aim of having impact at the ground. That is what global advocacy is, for impact on the ground to enhance health and well-being for all people.
You so much for sharing and for joining today. We This discussion is so important to understanding the role of nursing in global health, the impact of strong nursing leadership, and WHO's efforts to support and empower the nursing workforce. Fills my cup. Your insights and expertise are invaluable, and it's been really just wonderful to have the conversation with you today, Amelia. We are so, so grateful. Thank you for your time.
Thank you so much. Wonderful speaking with you. Have a lovely morning and afternoon.
Thank you.